one of the famous orthopedic surgeons in Mumbai and across India. He specializes in spine and joint replacement surgery. He has dealt with more than 10,000 surgeries and has rich experience of 36 years. He has also worked in various hospitals in UK for super specialization in spine surgery and joint replacement. Let's know more about lumbar MLD. Let's discuss what are the causes of lumbar MLD.
Slip disc is one of the most common reasons for back pain in present time. The most common cause for this is abnormal sitting, that is wrong sitting, or exercises in which we are bending a lot and lifting heavy weights without maintaining a good posture. Other reasons are long distance travels, sitting in the car for a long time, excessive use of floor sitting and lifting weights. In this, what happens is a normal disc, if we see here, if we look at the lumbar spine, we have a spine here in which this is the back skin, these are the bones, the front of the spine we are seeing here, and in between you see is the disc. Now disc acts as a high pressure chamber and which gets injured when we are trying to bend forward. So when you bend forward, the pressure on the disc is more, and when you lean back, the pressure reduces. So repeated bending forward causes damage to the disc, and the disc material can come out like this. When the disc material comes out, it can press the nerve which is just lying next to it, and you start getting leg pain, which is typically called as sciatica.
Now let's know more about the procedure of lumbar MLD.
Most of the slip disc recovers without surgery. With non-surgical treatment like physiotherapy, medicines, traction, belt, etc., the disc settles down in 2 to 3 months' time. In certain situations, that is less than 5% cases, the disc doesn't settle down and the person continues to get back pain and leg pain. During this time, we decide for procedure to be done called micro-lumbar discectomy or endoscopic discectomy after doing proper investigations. The aim of the procedure is to remove the disc material which is come out of its position and pressing the nerve. This is done with endoscope where the person is lying prone in a local anesthesia, or with a micro-lumbar discectomy in which we use a high-power microscope to remove the disc. In micro-lumbar discectomy, the procedure takes around 25 to 30 minutes in which the disc material which is come out is removed and the nerve which is getting pressed because of this is made free. This procedure is called micro-lumbar discectomy. Loose bodies within the disc is also removed during the same time, and the nerve is made free of any pressure coming from the disc.
There are some frequently asked questions by the patients that will surely clear your doubts.
The most common questions the patients ask is, will I get paralyzed? Or will I get complicated? Will I be able to walk after the procedure? So, for micro-lumbar discectomy is a very standard procedure. The chances of nerve root damage is far less with the recent advances in microscopes. When we are doing the surgery, we see the nerve very nicely and precisely, very delicately dissect the nerve away and remove the offending disc material. So, chances of nerve root damage or CSF leak or paralysis, these kind of complications are far and few. I have not seen a complication like this, like paralysis, after the MLD procedure in so many years.
Am I too old for the surgery? At our hospital, we have done spinal surgeries from the age of 21 to 90 years old for various problems of spine. If the person is medically fit and having back pain issues, spinal surgery should be considered. Am I too overweight for surgery? No, though the normal weight is desired, but surgery can be done in overweight patients as well. After how many days I can start walking? Patient is made to stand next day after the surgery with the help of support, and gradually the patient can start walking. How long physiotherapy will be required? For faster recovery, 1 month of physiotherapy is required. After how many days will I get discharged? Generally within 3 to 4 days after the surgery, the patient can go home. When can I resume my activities? If the patient is fit enough, then within 3 months, they can resume all the activities without any support. Any operation needs proper care and rehabilitation. Let's know more about how you should take care of yourself. Avoid bending forward and lifting weight. Avoid forward bending from your neck. Avoid carrying heavy bag on shoulder. Use cervical collar as prescribed for initial few weeks. Maintain proper posture while sitting and using laptop. Testimony of Lumbar MLD.
My name is Mayank Mistry and I'm 62 years old. I first developed a back problem way back in 1999. But initially I did not quite much pay attention, and then in 2004 it became a bit worse, and that's the time when I met Dr. Vinod Agarwal. First 2-3 months he treated me conservatively, including traction and various other forms, but somehow it could not get better, and eventually we mutually decided to go ahead with the surgery, and in 2004 I underwent a surgery. It was a microsurgery with hardly about 25 mm incision, and it was an open back surgery with just 25 mm incision. And in next day morning after the surgery, I was fit and about and started walking. And in 2 days, I was back home. And in next 20 days, I was back to my normal work. And then the life went on till about 2017. I got too overconfident. I thought now the life is back to normal, so I started doing things which I should not have. So I started lifting a lot of weight and a lot of other stuff, and that really aggravated the problem a bit. And so in 2017, I redeveloped the problem, and I again met Dr. Vinod Agarwal. And eventually after again a month and a half of conservative treatment, I underwent a surgery. This time the surgery was very different. Probably I was the first person in the entire Western Maharashtra who underwent this surgery, which is endoscopic surgery. So the best part about that surgery was that there was no incision at all. There was no cut. It was just like a needle pinprick, and through which they inserted a lot of cameras and stuff inside. I was fully awake during the entire duration of 2.5-3 hours of surgery. In fact, I was constantly talking to doctors, joking around, sleeping, and in between they would even tell me, okay, lift the left leg, lift the right leg, see if the pain is there or not. I was actually able to see my surgery on the monitors out there, what was happening inside my body. And once the surgery got over, there was no stitches, nothing. Just as we go and do, blood test, they put that white color tickling. That is what was just connected to my, wherever they had inserted the cams. And there I was back in the hospital room in about 3-4 hours. No anesthesia, general or local, nothing. So no side effects of any anesthesia. Again, like the previous time, next day morning I was fully walking about. And same day evening I was back home. And in about 2 weeks' time, I was again back to work. And that surgery happened in 2017. Now it's 5 years. I'm fully okay, fit, doing everything that I used to do earlier. The best part during this entire process has been meeting Dr. Vinod Agarwal. I think the amount of time that he spends with you in explaining what's wrong, the kind of treatments available, and his not insistence initially itself on the surgical part and trying out all the options was really, really good. I think equally good is the entire staff and the support system at the ARC hospital, including Dr. Madhura, who has always been my physiotherapist. And she's given me so many exercises, which is now helping me a lot, because now having gone through twice, I'm ensuring that I follow certain routine in terms of my exercise and backup. He also suggested a very beautiful device called Mackenzie roll, which I generally wear while I'm traveling, especially so in public transport. And that cushions all the jerks and the bad aspects of Mumbai roads. So the best part is that in last 22 years, barring those 2 episodes, my life is really good and back to normal. I otherwise don't feel the side effects of the back problem. I want to take this opportunity to thank Dr. Vinod Agarwal, the staff, Dr. Madhura, everybody, because of the wonderful way they have treated me all along, to such an extent that now it's more of a first name relationship with the doctor. So thank you. Yeah.
Yes, cervical MLD can change your life completely. The surgery is always one step towards no pain journey. Dr. Vinod Agrawal and his well-equipped hospital is always there with you in entire process. Then let's come together and conquer this hurdle and face the new normal phase of your life.